where the governor is having his first COVID-19 news conference of the new year.
Month of this pandemic. I'm delighted to be joined today by Dr. Romero, our Secretary of Health. We have Secretary Key of the Department of Education. I also have General Kendall Penn of the Department of Military, our Adjutant General, Director A.J. Gary, Dr. Cam Patterson, a great partner from the COVID Winter Task Force, as well as Chancellor at UAMS. We have John Vinson, Executive Director of the Arkansas Pharmacy Association, and we have Secretary Solomon Graves that will be remotely with us. You can see him there now. And so as you can see, we have a number of points to make today that are important that will focus on hospitalizations and vaccines. And let me first go to vaccines, and if we can put up the first graphic that you can see, Category 1A, as they're working on putting that up. So this is Phase 1A, which we are in now in terms of vaccine administration. And as we've stated before, this is for high-priority healthcare workers, long-term care facility staff and residents, and other high-priority groups. As you can see, the only change that we have in our guidelines is that we are following our CDC recommended guidelines except in two areas. One of them is that we did move first responders into 1A. And this was actually on the original CDC recommendation that they switched later. And we believe that they ought to stay in 1A because they are putting themselves at risk. They are our first responders, and our initial planning included our first responders in 1A. So that will be part of it, as well as the other priority healthcare workers and our long-term care residents. And if you look at this category alone, is 180,000 Arkansans are in this category. And our goal is to complete this by the end of January. So we have a lot of work to do. We're focused on that. We'll talk more about that. If you go to Phase 1B, the next graphic, this reflects the second change that we have, which instead of having age 75 plus in Category 1B, we have reduced that to age 70 plus in Category 1B. That is the population that's at risk in Arkansas. That was the consensus from our health advisors and our team. And this is a group at risk, and that we've comprised the group with the most deaths from COVID, so we want to put them in 1B. Now, in terms of 1C, which you can go to as well, and first of all, 1B, to put it in perspective, we had 180,000 in 1A. In 1B, there are 400,000, not even counting essential workers. And so you can see the monumental shift in volume whenever you go into 1B. And then 1C, of course, is even a larger scope of the population, but that will be people who are 65 to 69, people who are 16 to 64 with high-risk medical conditions, and then essential workers as well that are not covered in 1B will be in 1C. And of course, the essential workers are broken down based upon CDC guidelines in those categories of front-facing in 1B and these in 1C. And of course, it's necessary to have these priorities simply because we have a limited number of doses and our supply chain is limited. As it comes in, we'll be able to move more quickly through these different categories. We estimate that 1B, we're hoping that we can complete that in 60 days. Again, that is well over 400,000 Arkansans. We're still tabulating those numbers, but that is a significant goal for 60 days. There could be, down the road, adjustments in 1B or 1C, depending upon the acceptance rate, the opinion of our medical advisors, and so we'll continue to study the response and our needs that are out there, measure that data to make adjustments, but this is what our plans are, fixed for 1A, and we'll continue to identify the needs for 1B and 1C. Now, everyone is asking a couple of questions. When is it my turn, and how do I get the vaccine? Well, for 1A, the hospitals and pharmacies are setting up clinics and systems of vaccination for our long-term care facilities, our first responders, our healthcare workers. As I said, that's about 180,000. For 1B, which we hope to begin February 1, we'll continue to use the pharmacies because they are in every community. We'll continue to use our hospitals as they complete their healthcare worker assignment, supporting us on our first responders. They will be assigned a mission consistent with their utilization of their nurses for on-bed services, but to make sure that we can use our hospitals to carry out the mission for non-bedside resources for vaccination. We'll also utilize our local health units that will be having teams to vaccinate as well when we get to 1B. To carry out this mission, we're not only going to utilize the expertise of the Department of Health, but I've tasked Adam Director, our Emergency Management Director, A.J. Gary, as well as General Kendall Penn, who is here today, General Penn, right over here in uniform, to help coordinate the logistics of the vaccination initiative for 1B and 1C and the general population in Arkansas. They will coordinate with the Department of Health team. This will be a private sector-led effort that is coordinated and directed by the state. And so that's the partnership we have, relying upon the private sector, their expertise, their presence, and their relationships in their community. And the plan that will be developed in coordination with the Department of Health and General Penn and Director Gary will be presented on our website by January 15th so that everyone can see what's ahead for them, gives them over 2 weeks' notice before we get in to February 1 and the logistics of carrying out the vaccination to a broader portion of our population. Another question that's asked about the doses. Whenever you go in, do you get both? What do you need to do to get an appointment for the second dose? When you get your first dose, they will schedule an appointment for the second dose. And so that will flow very naturally through the course of the administration of this. And now if you look at the next slide, it shows you where we are today and how much work we have to do. I would emphasize that the data is delayed, and so CDC gave our reporting elements, which is our pharmacies, our hospitals that administer the vaccinations, 3 days to report results. And the reason is we want them vaccinating, and we give them a little bit more time to put in the information into our system. And so we don't have moment-by-moment information, but this is the January 5th report that we have received 134,425 doses, and we've given out 37,884. And as you can see, in the last 24 hours, we've added almost 3,000 to that total. 28% of those doses have been received and given, and that is this is at our hospitals, our state long-term care facilities, and our healthcare providers. Now, if you go down to the next category, our long-term care by CVS, Walgreens, that, as you can see, is 5.4% that has been administered. That is going to be picking up pace. I know that they've worked very hard to schedule appointments at our long-term care facilities, and I expect that to accelerate very quickly. With that, let me turn it over to John Vinson first, if you would come. Where's John? And give us a little report from the pharmacy side as to the progress that you're making and your plans.
Thank you, Governor. I'm John Vinson, CEO of the Arkansas Pharmacists Association. Want to just say a word that our profession is excited about this week. We want to reassure the public that our pharmacies in the state of Arkansas, our pharmacists and their teams are ready to begin vaccinations this week. I want to thank the governor, the state of Arkansas, and the Arkansas Department of Health, as well as other partners in the healthcare industry, as we are working really well together, communicating in this private-public partnership. One of the nice things about the private-public partnership is that as we're able to use our expertise, that trust that we have with our patients. The pharmacists consistently rank in the top 3 as America's most trusted most trusted professions. At the top of that list across all professions. We are in all 75 counties. We have pharmacies in 73 of those 75 counties receiving vaccine this week in partnership with hospitals, with a couple of, or at least one federally qualified health center, and also a Department of Health unit in Newton County. We will have almost 46,000 vaccines to be administered to health workers in 1A this week in the community setting. Up until this point, there have only been about 30 pharmacies that had received vaccines for our small to medium-sized hospitals in some rural areas that they delivered those. Those were called strike teams pharmacies. There were 8 of those. There have been another 22 for a total of about 30 that had doses that they're delivering to long-term care facilities. We expect that to pick up actually over the next week as those appointments are scheduled. And then finally, we have 212 pharmacies, and that number is there for a reason. That's the boiling point of water. And my kids go to Bryan High School. If you've heard of hashtag 212, we're about to bring the heat to this virus. I'm sick of it. I have family members that have been affected by this and friends. We're ready, now that we have the vaccine, to fight back and save lives, and our pharmacists are ready for this moment in collaboration and partnership with our other healthcare providers. As the governor said, in the future, there will be an opportunity for 1B and 1C. Our profession will be a part of a larger effort. We'll continue to provide vaccines. But I would like to ask the public this week to focus on those appointments for health workers only. For this week, the pharmacies are making those appointments quickly and efficiently for health workers. And if you're not part of 1A, there will be an opportunity, as the governor said, in the near future to schedule those appointments with both pharmacies, hospitals, physician clinics, and other partners, as that plan is coordinated by General Penn, A.J. Gary, and the Arkansas Department of Health. So with that, I would like to say thank you again, and we look forward to stopping this disease with vaccinating our health workers and then others as we get more vaccine. So thank you.
Thank you, John, for your partnership and leadership with all the pharmacies in Arkansas. Let me next give the COVID case update. And I'm going to recognize Dr. Patterson and Dr. Romero to talk about vaccinations and hospitalizations. As you can see from today's case report, that we have an additional new cases of 4,107. And so you can see the swings from yesterday to today. And you have new cases of 4,107. If you look at the testing on the bottom 2 lines there, you can see that we have tested about 8,700 total PCR tests and antigen tests. And some people will look at that and say, well, it looks like our positive cases are almost half of what our total testing has done. Well, you've got to remember that the positive cases are coming in for a series of days preceding, and so there's delayed reporting there, and so you can't just simply make that calculation. But clearly this is a high number of cases that has been reported over the last 24 hours. If you look at the deaths, very sadly we have 27 additional deaths. Our hospitalizations have increased 27. and our ventilator use has increased 12. We had a very good meeting today with our winter COVID task force that we talked about the hospitalizations and the steps that we can take. The ventilator use, there is adequate ventilator capacity in Arkansas, but I wanted Dr. Patterson, who's an instrumental partner at UAMS, but also a key member of our task force, to talk about both his perspective on the hospitalizations, but also where we are on the vaccines.
Thank you, Governor Hutchinson, and good afternoon. We had a couple of milestones yesterday. We had a record number of hospitalizations in the state of Arkansas, nearly 1,500 COVID-19 positive patients who were inpatient in the state of Arkansas. We've exceeded that again today, indicating that the upward trajectory of the virus continues to impact the healthcare systems here in the state of Arkansas. And at UAMS, we had the bittersweet celebration of the 1,000th discharge, safe discharge of a COVID-19 infected inpatient, which begins to put into perspective the toll that this takes on healthcare system resources. Speaking on behalf of UAMS, but also of the other healthcare members of the COVID-19 Winter Task Force and other leaders in healthcare administration across the state, we are stressed. We are strained, but the system is not breaking at the present moment. We do have finite resources, and so we do need to be careful as to how we manage those resources, and we need to continue to do everything that we can as a state to mitigate the consequences of COVID-19 while we wait for the effects of the vaccine to impact us in a positive manner. How are we dealing with the stress that this is having on hospital resources? Well, all the hospitals in the state are feeling an impact. We talk about this iteratively and repetitively. We were at a very tough moment in central Arkansas last week. At that time, we at UAMS were about to pull the trigger on moving to surge phase 2. We're currently at surge phase 1. And we were able to pull back from advancing to surge phase 2, but right now, North Central and Northeast Arkansas hospitals are feeling the brunt of the impact. So this is moving through the state in a fairly predictable way. Our surge phase 2 for the University of Arkansas for Medical Sciences would be to begin to double occupy single bedded rooms. We have fitted those rooms out from an IT standpoint to allow double occupancy. We would increase the expansion of our emergency department into an adjacent parking deck that will allow us to accommodate more flow through the emergency department if that is needed. Across the state, other hospitals have similar surge plans that they are willing and ready to execute if need be. In addition to that, Baptist Health, in collaboration with the Department of Emergency Management, is building out additional inpatient bed resources that could be brought online if needed, if the situation becomes acutely critical. We are all monitoring this on a daily and hourly basis. For right now, the system is holding. We have capacity to surge and expand if that needs to happen. That capacity is not infinite, but I don't foresee a critical moment in the next 2 to 3 weeks. I do anticipate, though, that the strain on the healthcare system will continue to increase on a week-by-week basis as the number of cases continues to increase. I want to thank the Arkansas Department of Health the Department of Emergency Management, and everyone who's been responsible for distributing vaccines. Our cohort in 1A at UAMS and across the state in hospitals has been vaccinated and is nearing completion at UAMS. We started yesterday the second dose of vaccines for individuals in our 1A cohort. We've had no significant adverse events. The virus is safe the vaccine is safe as advertised, and we are on track to meet or exceed the timetable that has been established by the Department of Health for vaccinating our 1A team members. So the good news is that this very first phase of vaccine distribution is going smoothly, it's going safely, and my hope is that we can actually accelerate the timetable that has been set to distribute the vaccine across the state. So I want to thank our partners across the state for allowing us to provide great care, and the hospitals in the state of Arkansas for the present moment stand ready for anything that gets thrown at us.
Thank you, Chancellor. Governor. So I'm going to build on what has already been said and give you a little bit more detail. Let me start with the numbers. It's a record date today for active cases, which are 24,480. We also have a record number of hospitalizations. As mentioned by the governor, we've increased by 27, and we're now at 1,322. And our ventilator use is increasing. We still have capacity in these areas, but if we don't guard them carefully, we will exceed the capacity that we do have. It's important to note that right now we are compensating for these increased cases, but these cases will increase. I unfortunately need to say that today, because what we are seeing now is what I and all of us have warned about. That is a surge on top of a surge. And how much of a second surge we have on top of that first surge is unknown. It's concerning that today we have over 4,000 cases. Over the weeks, if you go back and look at our reports, you'll see that we slowly rise over the week to culminate on a Friday with the high numbers. So if we continue with that trend, we will see significant numbers. It is up to each citizen to adhere to the three W's that we've talked about. This can be slowed down. It cannot be completely stopped at this point. But it is up to each citizen to adhere to this. This is not an exaggeration. The numbers are as they are. So wearing the mask, social distancing, washing your hands is essential. Avoiding all non-essential congregate joining of individuals is essential to bringing this under control, or we'll have this problem with beds in the future. A couple of words about our phases. So our phases are being modified. This is not out of the norm. The ACIP, that is the CDC guidance organization, left it to the governors to make modifications that were appropriate to each state. So this is not a deviation. It is a modification to meet the needs of the citizens of Arkansas. With regard to transition to phases, so each phase will be moved from one to another through gating processes. These gating guidelines will determine the number of individuals vaccinated, the degree of uptake of the vaccine, and we will make a decision to move forward. We have tentative timelines, but as you heard from the governor, we have significant numbers in these phases, and those are going to be important in determining it. A further modification may come as we get more vaccines in the future, because there are at least 2 other vaccines in the pipeline that may be available in the next 2 or 3 months. Lastly, let me just say that it is important to reiterate that this vaccine has been shown to be safe during all 3 phases of its investigation, during its licensure, and in the post-licensure phase. We have had 22 reports to what's called VAERS, that is the CDC reporting system. Since this vaccine has been released in our state, none of these are serious. These are minor side effects. So I'm sorry if I spoke over my time, but I wanted to give that information. Thank you, Governor.
Good comments, Dr. Romero, and we have 2 quick comments or updates from Secretary Key, and then remotely we'll have Secretary Graves.
Thank you, Governor. This week marks the return to school across the state of Arkansas, and many of the questions that we've been receiving at the department centered around COVID emergency leave. As you may remember, in the first semester, the CARES Act Steering Committee approved $15 million to set up a system of up to 2 weeks of paid emergency leave for school employees if they were tested positive for COVID-19, had to quarantine, or were caring for a dependent who was subject to quarantine. Those funds have been depleted at this point. However, we would encourage districts to consider continuing that policy of providing flexible leave options across the state. It has been an important part of our success across the state so that teachers know that they have that option available and do not have to use their own personal leave that can be used for other types of illnesses. Districts can choose to use local funds, or they can use the new federal funds that I mentioned last week. Arkansas is subject to receive over $500 million from the latest federal stimulus act that will be going directly to schools. This is more than 4 times greater than the amount of the ESSER funds they received in the first semester. And we would encourage districts to take a look at their policies and create flexible leave options for their employees. And they could use local funds or use these new federal funds in order to do that. We will be issuing information through a commissioner's memo to superintendents later this week so that they will have all the details on how to do that. We are also working with the Arkansas School Boards Association with respect to model policies that districts can consider. Thank you, Governor.
Thank you, Johnny. And Secretary Graves, are you with us there?
Yes, sir, Governor.
So if you could just make a brief comment as to what's happening in the Department of Corrections today.
Yes, sir. Our current case count within the Department of Corrections is at 286 active cases among our inmate population. Of those, 4 current inmate cases are hospitalized. We have 153 staff out from across the department. Yesterday, we began our vaccination program within the department with our medical staff from our contract medical provider, WellPath. We will continue those vaccinations of medical staff throughout this week and also begin to vaccinate our security staff who are permanently assigned to medical support roles. We have received 975 doses from the Department of Health. That is adequate supply for our 1A plan, which, as previously alluded to, includes our medical staff and designated correctional officers.
And that's going to happen this afternoon.
Yes, sir.
That's great news. Thank you, Secretary Graves. With that, we're happy to turn it open to questions.
Could you explain the reasoning for having the 1B group include 70 and older as opposed to 75 and older? Like, what is it about Arkansas that you felt 70 and over was more appropriate?
Well, as you can see from other states, this is one area that, for example, Florida, I believe, till a couple more months down.
Make all the magic happen.
I do.
Well, now you're in front of the camera.
I am. So
Well,
thank
I'm glad
you so
that you're
much.
here. Thank you.
Thank
Now, Chris has an envelope. The Money Fairy has that envelope.
you. Okay.
So there is money in